Let's see if that will work. I'm Dr. Qazi. I'm over in Newport Beach, California. This is my live show. I do it at 9 p.m. Pacific time, Monday through Thursday. And I'm going to go through really all things that I do, which is acne and scars and pigmentation. And then also I do a lot with facial balancing as well. So I'm showcasing a patient right over here. She did a single combination session right here. I'll wait a few more moments for more people to come on. But this is a really, really wonderful result. This is a patient, she came in all the way from Kentucky and really thrilled, really pleasant patient. And just want to showcase this for you guys. This is, what we could do just after a single time sometimes for certain patients, particularly with this patient. A lot of her scars were more of rolling scars, and with those kind of scars, I've talked a lot about that before. Doing subcision, doing a little bit of volume, that can make a huge difference in it, and you can see that result pretty quickly. She also has some ice pick scars, although some of her ice pick scars are relatively shallow, so I was able to get to the depth of the scar really well with the laser. It worked out incredibly well for her. Some of her ice pick scars are just completely gone. Sometimes I get people asking all the time, will you ever get 100% resolution of the scar? For some scars, like relatively superficial ones, it looks pretty close to that. Now if you get histologically, you pull it out, you can see there's still a little bit of scar tissue. But for people looking at you, you're looking at yourself in the mirror, you're really not going to notice that. So it's pretty close sometimes to scarless for some of those more superficial scars. Of course, this patient also, she's a patient who is Fitzpatrick 2, but she did have melasma actually. So I had to do some things to suppress her melasma, her pigmentation, so that way we didn't overly stimulate it. And for her, she's out of state. She's over in Kentucky, and she's more local. I could work on her melasma a lot more with potentially like the pico laser would work really well. User 95 is saying a difference between scars and post-inflammatory hyperpigmentation. Good question. So post-inflammatory hyperpigmentation, those are those little brown marks that sometimes you could happen for acne-prone skin. You could see where you had the acne, it was red, and then it turned darker afterwards. And now it's like more like a flat, dark mark. And that sometimes goes hand in hand with scars, and sometimes it makes the scars look a lot worse. So especially when it's like more pinpoint spots at the area that the acne was, and now you have a scar there as well, and now you have a dark shadow there from pigmentation. It looks like the scar is really, really deep now. But really it's more pigmentation. Sometimes you can also have post-inflammatory hyperpigmentation where it's really more like, let's say you were even 5 years old, 6 years old, you go out in the sun and now your skin is relatively is stained a bit darker than it normally would. And that also actually potentially makes it seem as if the scars are a little bit deeper. So part of what we like to do sometimes for patients when there's pigmentation issues is we like to solve their pigmentation. That's not just the dark pigmentation though. Sometimes that's also the red marks. So if there's little broken capillaries, something called post-inflammatory erythema, we sometimes have to target those also with a laser energy device, or we can use some topical creams like niacinamide, for example, for post-inflammatory hyperpigmentation, post-inflammatory erythema, I should say. For post-inflammatory hyperpigmentation though, sometimes azelaic acid, like 10%, it could be a good starting point. You also, I've talked about it before, but Eucerin's pigmentation cream actually is a good idea, just over the counter, it works well. It's slow, but it can help. Of course, a lot of sunblock. I see someone on here from Neutrogena. So I will say, he's actually a really nice guy. He comes by, and I will say that his the Neutrogena's new sunblock is actually really good. It's not a sponsored thing, I'm just telling you. But he knows before that I actually didn't really talk too much about the previous products before. But the newer one has got a high concentration of zinc oxide. It has a little bit of tint on there too. And just so you know, it's pretty cheap there too. This is not sponsored for them at all. But just like telling you, it's kind of interesting enough. They used to be like white, like pasty, and now it's like it comes on really well, especially for patients of who may be a little bit darker skin type. OZJ saying, with TCA Cross, how quickly do you see a difference in patients' skin on average? I can tell you though, it just depends on the depth of your scar. If it's a pretty deep scar, usually 4 to 6 sessions, but sometimes it could take even more. It ultimately gets there. I know people get impatient with it. They expect there to be fast results, but you just have to go really slow with this. You got to go really slow, especially with ice pick scars. There's just not really a fast way to improve it, especially if they're very deep scars. Even in lighter skin types, it's potentially going to be a slow process. It's not going to be something that you can just go rush that. And sometimes when you end up doing it, it actually could make the scar worse, and you could end up more complication. T-Chain is saying, hi doc, I'm excited to schedule acne scar treatment with you. Do you think I could do this 6 weeks after giving birth? I saw you for consultation about 1 month ago. I remember you really well, T-Chain, and I'll be happy to help you about 6 weeks afterwards, but typically I want to make sure your weight is also relatively stable too. So you probably will have a little bit of weight, if during pregnancy process, and I want it really where it's more stabilized. So ideally, I'd like it where it's at a more stable level, so I could then determine how much volume we have to do afterwards. But if it's more like, okay, we just have to do TCA Cross and a little bit of laser, that's fine. But like we're talking about like volume replacement, we'll probably have to push that a little bit later on. Travis is saying, one at-home product that can make a dent, pun intended. Well, we don't want to make the dent, but different cream works well. So just start with different. Use that to you can get that at Target. It used to be in my time, it had to be a prescription, and now it's over the counter. So it's a really, really good product just to be able to do initially. Just mix it with a little bit of moisturizer, just a pea-sized amount of different cream, a pea-sized amount of moisturizer. Rub it together, dilute it a little bit for the first week or two, and you should be okay. Let's see here. Tears of Geisha saying, wow, beautiful result. What was done here? So for this patient, we did Subcision, we did TCA Cross, we did a form of the ablative CO2 laser, fractional CO2 laser, fractional Erbium laser. I also did some Bellafill that day, and then through the laser channel holes, I placed a dilute form of Sculptra for her. She actually does come on sometimes. I wonder if she's on here today. If she is, say hello. Hey, Alan, how's it going? Appreciate you, by the way, too, for coming on and answering questions, too. Brenda is saying, will tretinoin get rid of red acne scars? Maybe not so much. You could try azelaic acid, though. You could try that. That's not a bad idea. Just 10% azelaic acid over the counter could help with that. Rosita saying, hello, Dr. Qazi. I'm new here. What is your take on Accutane for hereditary acne? If there's cystic acne, you got to do something for it. And, if it really is a cystic acne, do Accutane, isotretinoin. Do it if you have it, because I really want to make sure you don't end up with scars. One of my big things in life is to stop people from getting scars. I know I treat scars, but I want it basically solved so people don't actually get scars in the future. So if you could get that, with isotretinoin, do it. And really, there's multiple different options. I've talked about people before. I was on Accutane 3 times in my life, and each time it did get better, but there were side effects. But ultimately, I'm glad that I was on it, because otherwise I would have had worse scarring, and it would have been it was just terrible because nothing was working for me. Topical antibiotics weren't working for me. Oral antibiotics weren't working for me. Nothing was working for me. I like that we now have options just like Accutane. My time there wasn't another option. We had nothing else. It was just Accutane. And now at least we have a laser that works just like it, so it's awesome. That's why I like that, because it's I liked Accutane. It was fine for me. But it was also overly drying. My skin to this day, my back is still dry. I lost some hair on the side of my scalp, and it's I had really, really chapped lips, really excessively chapped lips. And it was, socially awkward, things like that. So it's at the same time, I wish there was an alternative, because I probably would have taken the alternative if there was. Let's see here. Cal Ray is saying, hi, doctor. Can you explain about collagen responses to treatments? Yeah, actually, I was talking a lot about that today with a patient, just because it's something on my mind a lot, especially, some of my cases are people like this patient, for example. She came in a couple weeks ago, and her collagen response looked awesome. And, she's somebody who is in her 40s. And it's what was she doing differently? It didn't seem like too much, though. It's not like there's other added supplements, things like that, really. But some of the patients that are out of state have been having really fast responses than some people that are sometimes in LA sometimes. And it's interesting, because LA's water is kind of notoriously not great. There's a lot of high mineral concentration in there. And it makes you wonder, is it possible that that's a contributing factor, that putting this harsh water, even if you have a water softener, is still a certain amount that of minerals in there? And maybe that's a contributing factor for like more inflammation after you do a laser session, and then that inflammation, prolongs your healing process and delays the collagen response. Maybe it's just something I'm thinking about, like I know that there's also aspects, of course, like I've talked about before, of genetics where certain ethnicities do seem to have a faster collagen response than other ethnicities. But part of it also is water too sometimes, because like this year, actually, I don't know if anybody's on right now, but this year I've had multiple people from Minnesota of multiple different ethnicities, of every single ethnicity really, and it's interesting because each one of them has had really fast collagen response, and like it's like Minnesota's known for like 1,000 lakes and everything like that, right? So it's like, is their water quality better than our water quality over here? Possibly. Maybe that's like a factor. And I've had people who for a little bit longer than I would like, they were more red or irritated, and they ended up having them just use bottled water or distilled water, and the inflammation on their face cleared up just after a week. It was really rapid. And so it's like, it's really interesting. Is it possible that's the case? I'm not, these are anecdotal things. I don't have the study right now, but for those who've done a bunch of procedures, I'm going to like probably go through it one day and really ask you. Excuse me a second. Cinderella Perla is saying, I moved into a rented house and I think the water is also messing up my skin. I'm in Houston. We have very hard water here. That's really interesting, actually. That's a really interesting statement. I wonder, I have a lot of patients from Houston, a lot of patients over there from Dallas, and it's like, I wonder, actually, that is an interesting factor. Whereas like my Minnesota patients, they're healing really quickly. Some other states also like really quickly. They tend to be more of like the central states though. People that are just like kind of like probably better, but with better water conditions. Although I've heard from people like Vegas pipes apparently are really bad too. So I don't know. G saying, I went swimming in the Dead Sea when I had acne and it cleared me up for a while. I think actually, I got to double check, but I think there may be a little bit of sulfur in the Red Sea. I think there may be. I've got to double check. I told you actually before, I think you were on one time, G, when I said that when I was in Costa Rica, I went to the volcano area over there. And I was really, not too young, but I was like, I think in college or something like that. And I ended up putting like the mud, the volcano mud on my face. And I had bad acne at the time. And it cleared it up, and it's really rapidly. That's why sometimes I talk about like one of the big great things for acne, do sulfur. Sulfur is really good for acne. And there was a lot of sulfur in that volcanic mud. And it worked really well for my acne really, really fast. So like the rest of my trip, like the first part of the trip, like I had like a little bit of acne. I didn't even feel like taking photos. And then the rest of the trip, my skin was super clear and I was taking a bunch of photos. So that's really funny. Let's see here. Something, I'm not sure what the screen name is saying. Will 70 milligrams of Accutane fix my scars and pigmentation? I've been on it for a month and it's the same. Probably not so much. No, it may help a little bit with scars, may help a little bit with pigmentation, but probably not going to be the thing that's going to cure it though. I think that's a pretty tall order to ask. And also a lot of things depend on just, essentially what your weight is really. Let's see here. User 63 is saying, Dr. Q did my Bellafill 2 months ago with good results. Awesome. Appreciate you for coming on and saying that. The thing with Bellafill is that it's really difficult for people to understand sometimes. It's not like just a filler, although there is like this plumping effect immediately. It does go down, and then over time it does get better. It's really interesting like that. It really is very cool because over time your skin quality gets better. Let's see here. I know I missed a few things there, but Period is saying, I'm 13 and have scarring. Will it go away when I'm older because I'm so young? It could actually. And I hope your acne is relatively under control. But you could actually also start with some sort of retinoid, like potentially. Double check, go to a dermatologist, double check what's going on with you. But you potentially could actually see about being on like a retinoid even at that age. I started mine when I was like 15 or 16 years old, and it was very great. Lion Wishperer saying, wish I could afford getting treatment under you, Mr. Qazi. Well, I appreciate that. But what are you trying to do? I'm not sure what would be the thing that that you're trying to treat though, because otherwise, I'm not sure if it is that expensive. Maybe it's not that expensive. Blake is saying, lost a follower, ignored a simple question 20 times that could have helped a child. Wow, what was the question that was asked 20 times that could have helped a child? And Typically, you don't have to announce when you're leaving, but I will try to help you out if you really are trying to help. I haven't seen this question. You may have gotten caught up in like a spam box, and there was no reason to take offense to it. I try to answer every question. Everybody knows, anybody on here knows, I try to answer pretty much every single question that comes on here. Just sometimes I misses it, and sometimes there's like a spam filter that TikTok does, and I'm not sure what you're posting on there, or if you're posting on multiple different platforms and multiple different accounts on here, and maybe got trapped in the spam box. But I try to answer pretty much everybody though. And like even things that like people will ask me that, it could be a little bit more like a tangent. I still will go into it if it's something that you really want to know. Where is a sculptured place at? I'm not sure what the question is. Asking where would you put Sculptra at? Sculptra really actually could be done anywhere. It was originally for AIDS patients, and basically one of the big things with it was that there was muscle wasting, but you didn't have much fat, and so sometimes you have to do something for volume, something to improve the appearance, and Sculptra was one of the things that came out for that and got FDA approval for that. So it was like really severe muscle atrophy. So it was really done really kind of everywhere across the face. And it ended up being, muscle face, fat pads that just were completely gone or displaced. And so it's like Sculptra ended up giving you some volume and then also giving you some collagen, so the skin quality improved. So you could really place it really almost anywhere, but you normally don't do it at all over the lips. Really bad idea. You definitely don't want to do it in areas where you're kind of moving, or those areas where you're like lifting. So for example, like you're above your eyebrows, for example, not good idea. You don't want like these circular areas, so you don't want it around the eyes at all. Really bad idea. I think I saw, I'm not sure if it was just like a poor title or whatnot, but there was something that was going on TikTok, and the person was comparing PRP and Sculptra for under eyes. And I'm not sure exactly what they're referring to, but definitely I would not recommend doing any Sculptra under your eyes. Really, really risky. Teaching is, I hope I'm saying your last name right, by the way. You said, sorry, you got cut out a little bit for me, but you said it's okay for TCA Cross Subcision laser first and then filler maybe 3 to 6 months later. Oh, perfect. Okay, so it looks like I already knew that, and so I was on the right track at that point. So the reason why with pregnancy, you want to wait till your weight is stable afterwards. So you're pregnant right now, baby's about to be due. Congratulations, by the way. Good luck with all that very, very soon. But you want to do something for your skin, so I'll be happy to help with your skin. And then when you need the volume, I'll see that really later on. Shri is saying, is it possible granulomas after Bellafill? A lot of the granulomas are really occurring, I would say, if it does happen. First of all, it's a very, very low incidence, but if it does happen, really it's more likely due to an infection, due to basically some sort of contamination, which is why I use multiple different ways to sterilize the face whenever I do Bellafill. And I don't run into any problems. I'm very, very careful with making sure the skin is super clean. For those who know when I'm doing it, I'm doing like HIPAA sometimes. I'm doing just a very strong alcohol. So I'm really making sure that it's really as clean as possible whenever I inject. And you just start with good habits like that, and then you'll run into problems later on. I think that a lot of these type of things are due to user error. Sometimes it's due to potentially a reaction or something else happens, some sort of mishap, and that's okay. That's always a bit of a risk for that, but it's extremely low. And there's somebody that I know pretty well, and he sometimes deals with granulomas kind of nationally. And he said, first of all, it's a very low incidence, but what he's done before in the past for them is he's done a little bit of steroid and something called 5-FU, and it works well. He says he's never had it prolonged. So interestingly enough, and he's somebody who is a Stanford trained physician, a facial plastic surgeon, and that's what he tells me. And so it's like, okay, and like he's not represented by a company, anything like that. So it's like, okay, awesome. Like he just likes the product, and he says that he's never run into a problem that he couldn't solve with that if it ever happened to be a granuloma. Anna's saying, may I ask how old you are? Your skin is perfect. Yeah, you can ask away. I'm 42 years old, and what was the other question? Oh, yeah, just your skin is perfect. Thank you. Start with tretinoin. That's one of the easiest things to do. Really consider doing that. Let's see here. What's more effective, applying Sculptra topically through channels or injecting it? So when we're doing it topically, we're not really trying to volumize patients. What we're trying to do is just trigger more collagen. And so that's what I'm doing with that. I'm using the laser tunnel holes or microneedling holes basically to trigger more collagen. And it's a very different process than really when we're injecting it, where we're putting a ton of the Sculptra product in one area really to give you a lot more volume. So it works really well for volume like that. It's something that of the collagen stimulating products, the biostimulators, I think probably gives you the most volume. But sometimes you actually don't want that kind of volume. That's the thing. That's actually what's not disclosed by a lot of people. They say do Sculptra, Sculptra, Sculptra. But the thing is that, when it comes to the jowl area, for example, you have some hollowness over there, you could really rapidly overshoot Sculptra. It could end up being a real problem, actually, because a person, may look okay right now, but 5 years down the line, 10 years down the line, they're getting jowls because you put Sculptra in there. So I would really recommend, being really careful in the places you do it and who you do it with. Marielle is saying, how long does Sculptra truly last? I hear 5 to 6 years. Well, you get to keep the collagen portion of things for that long. So the studies that they have are 2 years, and they say it gets absorbed at that time. I'm not sure if it lasts. I think it may last longer. I think just like we have found that HA filler is essentially some of it's like semi-permanent, 10 years. I've had a patient 12 years that had filler underneath the eyes. I had to dissolve. It worked really well. It's clearly because of the filler. I used an ultrasound to look at it, made sure that it was okay. And it was filler, and it was like clearly filler, and dissolved it, and it got fixed. And so it's like, clearly it lasted a lot longer, and it's been happening a lot longer than I expected. I talked to one of the Allergan, CMO at the time, and I was asking about these things, and they were just like, we have to look for more what the data shows, this and that. Doesn't show any evidence, but like just because, there's two different things. When someone says there's no evidence, is it because someone didn't research it, or is it because like the evidence showed that it didn't actually work, or it didn't last that long? That's the question. But if there is actual evidence, then it showed that the filler lasts actually only 1 year. That's a different thing. But they don't actually have it like that. They just sort of stop studies. So it's very different than saying that filler just lasts a year. It's like you stop the study after a year. Triple X is saying, is the Vertporphin project on hold to really continue to work on it in the future? I definitely plan on doing it in the future. As soon as I could get an FDA waiver, I would do it immediately. As soon as I could do that. So yeah, it's the election year. If you guys want to talk to people that could get us pushed over, it'll be awesome. Mary is saying, it scares me that the studies aren't long-term enough. Yeah, it wasn't in their interest to. And they want to get the product out really rapidly. So it's not in their interest to actually have a really long study. These studies are very expensive. It's actually extremely studied. I don't know, I haven't talked about this before too much, but like when I have a Subcision paper, and it's a really good paper, but to submit it to each journal, I have to pay sometimes $1,500 to like $3,000 sometimes each journal that I'm submitting it to. That's in order to try to get a paper that I think is really important for acne scar patients. I think no matter where they are, they should know that there's a way to do subcision really safely. And I want to make it that this is more like the standard of care. That here's a bunch of studies that I have, a bunch of patients that I've done. This is my safety profile. Here is my data. This is how you should do it. This is how I do it. I use a blunt cannula most of my subcision work. I'm going through multiple different layers really, really carefully. And then if it's stuck, I may use more sharp tools, and it's typically just in certain areas, and that's why I don't run into problems. So I think that'll be a really valuable study for a lot of people, just to be able to see and like just learn, no matter where they are in the world, that here's a guy who does so much of this, and it's like, this is how to do subcision going forward. And if I don't do it that way, I could run into a little bit more risk because he's already done a certain way, and he is very, very safe at doing it. So, it's worth me following along with that and at least learning that. And then I could decide. But like, if you don't, you can't get it published, it kind of sucks. And let me tell you, it's like for an independent physician, $1,500 to $3,000 per journal per study. That's like astronomical. And so now imagine anything else like this. But like certain things are just worth it. Like it's just like, I think it's worth it. It's great to do, but it's really a ridiculous system. It's a really ridiculous world that we have. And people are so proud of this capitalist system that we have. And I think it's so great for research. But how is that great that like a guy like me who wants to do this stuff and push this stuff, but has a business and doing well with the business, why would what incentive do I have to go push that like that? So it's like, I think studies really should be more heavily subsidized, and we just have to be honest about what is involved with the funding for these things, because it's really unfortunate that like physicians have to go run around and pay this much every single time they want to study something. It's crazy. And I feel terrible about the whole thing. We could be learning so much more, and who knows what other doctors are out there that have such great ideas we can't learn because they don't want to spend $1,500, $3,000 per journal. This particular patient, we did TCA Cross, we did Subcision, we did ablative CO2 laser, we did fractional CO2 laser, fractional Erbium laser, we did Bellafill as well, and we did through the laser channel holes dilute Sculptra. All right, guys, thank you so much for coming on tonight. If you had any other questions that I may have messed up with I was reading someone's question, said they got messed up with a masseter Botox, the psoas muscle got hit. Fortunately, it's a temporary issue, but I know that does suck though. Sorry that happened to your friend there. That's a tough one. Let's see here. I know I may have missed a few things that people were asking. If you had something really pressing, I'm going to give you a minute here just to re-ask that. What's the best filler for boxcar scars? What other treatments would you do for indented scars? Best treatment is going to be some sort of filler. But it could end up being just Bellafill. That may end up being the best option there.